Hello, and welcome to another episode of The Soul of Business with Blaine Bartlett. I am obviously your host, Blaine Bartlett. In the midst of this pandemic, and I'm saying this just most of these shows are greenfield in the sense that they've got a long lifespan on it, but this has been around and it's going to be around for a while. And I wanted to have on the show today somebody that is actually on the forefront of a lot of work being done in addressing how healthcare is addressing the COVID pandemic, both in the US, but also globally. Peter Angood is my guest today, and he's the CEO of the American Association for Physician Leadership. And Peter's been in that role for 10 years. And I've been fortunate enough, in full disclosure, I've been fortunate enough to be part of the faculty of the American Association of Physician Leadership for a number of years now. And I've gotten to know Peter fairly well enough to call him a friend. So, Peter, I just want to welcome you to the show, and I look forward to this conversation.
Well, thank you, Blaine. It's a privilege to be with you, and it's actually been a privilege to have you as part of our faculty for many years, and been very enjoyable to get to know you as well as a friend. And your ongoing initiatives and efforts are very strong contributors to the whole field of leadership. So I look forward to the conversation.
Well, thank you for saying so. I appreciate that. Now, let's just kind of do, before I get into the question I typically ask at the beginning of this thing, what is the AAPL, American Association for Physician Leadership? Because it's not a new organization. It has got some beard to it. It's been around for a long time.
Yeah. So, well, as its title implies, it's got something to do with physician leadership, right? And even though it's an American association, it's an international organization. It has been around a little over 45 years. It originated with a focus predominantly on mid-career physicians who wanted to go into management roles inside of hospitals. And still true to this day, when you go through medical school or you go through your specialty training and even through the early stages of your career, in healthcare and in the physician world in particular, you get zero exposure to leadership. You get zero exposure to management. So our organization over its 45 plus years has wound up being the, not just national, but internationally, the dominant organization as a bridge type organization to provide the full spectrum of services and programs and products related to leadership and management for physicians, and gradually we'll do more in other professions as well. But that's the essence of it. It started out as an education enterprise, but now it really is focused on the full spectrum of, as I say, programs, products, and services around leadership and management. And not just for the individuals, Blaine. We're also recognizing that institutions where physicians practice really need a lot of assistance on how to better work with the medical staff and the physician workforces, because historically that's been an interesting relationship. And as we move along in healthcare as an industry, institutions and organizations need some help. So we do that too.
Yeah. And you do it quite well, I might add. Yeah, yes.
We hope so.
A shameless plug in there. Yeah. Well, healthcare obviously is on the forefront of a lot of things right now, and there's such stress in the system. And I'm going to use that stress in the system as kind of a preface to a question here around the soul of business, the soul of healthcare, I guess, more than anything else. So when you hear the term the soul of business, what does that evoke for you? What does that bring up for you?
Yeah, well, inherently, healthcare is a very complex industry as a whole, far more so than many other industry types. And we can get into some of the details of that as we move along here. But the essence of healthcare is still trying to help people, folks like you and I, but all types of people, not only remain healthy, but certainly to help them when they get ill. And so the soul of healthcare is really that altruism and caring for other people. And one of the pivotal aspects of that soul, and it still drives healthcare predominantly today, is that patient physician relationship. And it's that altruistic trust that comes in between that relationship of those individuals and that caring and altruistic approach. To me, that's the soul of healthcare. And
Yeah.
it really is, for a lot of folks, difficult as an industry, because it's complicated as an industry, but it's difficult to stay focused on that soul piece, to use your term.
Yeah, yeah, and that's one of the reasons I wanted to just kind of get your take on that, because in my experience, the hospital systems I've worked with projects that I've been associated with Aapl, and delivering different educational platform programs. The complexity, I mean, and to your point, I mean, it is probably one of the most complex systems. Not just industries, but one of the most complex systems I've ever stepped into. I mean, it's mind-boggling in the complexity, and then you add on top of that the layering of complexity of medical care itself. Take out of it all of the regulations and everything that kind of go into it. But how do you attend to an ill patient? The leadership component comes into play here very strongly, because and we've talked about this. My definition of leadership is co-creating coordinated movement, and in complex systems, that becomes absolutely the litmus test for how well I'm doing as a leader. With today's pandemic, what are some of the challenges that you find that physician leaders, or that leadership just generally in the healthcare space, is really wrestling with? It is actually kind of what's the word I'd use here? It's actually new. I mean, it's appeared in the last 18 months, and it's something that's blindsided leaders in a way that they weren't expecting.
Yep. Let me come at this one a couple of ways here. My clinical background is as a surgeon, and I spent 25 years doing trauma surgery, which is not emergency medicine, but it's the high-end, highly acute stuff. And I've always said during that time, the best and fastest way to get into a hospital and looked after well is to get yourself into a bad car wreck, because you're going to get into that hospital and taken care of very quickly, very efficiently, and you'll get top of line care. And so what the pandemic is, for those places, for the folks that are very sick, they're getting good care. They're getting in through the emergency departments, they're getting into the ICUs, they're getting their diagnoses, they're getting on ventilators, and the dedicated staff of nurses, physicians, pharmacists, all the ancillary providers are really on that kind of mode of let's provide the best care for this emergency. But they're getting worn out, as we all know. And so the leadership piece has a couple of levels in here as well. When institutions are highly stressed for whatever, an environmental disaster, some kind of industry disaster, whatever, the administration of an institution oftentimes will defer to the clinical leaders to just let them provide that care in those high acute settings. And so we've seen a lot of that across the country and around the world, where the administrators, yes, they've helped to form crisis action teams, but the leaders of those crisis action teams are usually physicians or physician and nurse teams. And the other administrators come in and try to help out with the supply chain issues and coordinating other aspects of care and all those types of things. And that's good, because what we've been recognizing over the last number of years actually is when you have physicians who are well exposed and educated and experienced with leadership and management, typically those institutions, those organizations will perform better, as long as those physicians are able to create that influence that they have been prepared for. And so a lot of that is, well, how do you work with others? How do you work with other clinical leaders? How do you work with non-clinical leaders? And how do you exert the influence, not unlike the definition you brought forward at the beginning of the conversation here. Now, let me take it a step further, though, because I want to highlight just how complex this industry by giving us some numbers that you won't see in any other industry. In this country, United States, we're approaching $4 trillion as an industry. It consumes about a quarter of the federal government's budget, highest percentage of any other aspect of the federal government. It's well recognized there's about 25 to 30% waste and inefficiency in the system. Roughly 20 to 25% of the dollar is just going to support the financial aspects of the industry. And we carry a 10 to 15% major error rate. Just think of those numbers for a moment, Blaine. Just think of those numbers. And
Wow.
so, yeah, can you think of any other industry?
Wow,
what industry would tolerate that, right? None.
Yeah.
And yet,
Yeah.
it's not like there's a bunch of bad people in here. We're all working hard trying to make it better. And we all know it's got to get better, but the inherent complexity of the systems, the processes, and the slow approach of creating lasting change is difficult. So now you got this acute pandemic on that inherently complex system being stressed out. We're seeing good things happen, but we've got a paradox. And then I'll turn it back to you. But we've got a paradox. We've got places, especially now, I saw a number today, of the acute cases going on with the pandemic, 98.8% of them are the Delta variant now. Yep. So we've got the Delta variant pushing us along. And so we're seeing a swell of utilization going on again. And yet the paradox here, you've got a lot of other aspects of the industry are underutilized because we're over preoccupied with the pandemic. So you got excess utilization and underutilization. And so you got to, how do you lead and manage through that stuff, right? And how do you survive financially?
Yeah, that's an interesting question because I'm working with a couple of different hospital systems right now where elective procedures have just literally, which is the bread and butter for many hospitals systems, and the beds are full with ICU COVID patients, and it's overflowing. So the question of leadership, it's not one size fits all. I mean, certainly, I know that you're familiar with this, and leading in an OR is different than leading in a clinic, which is different than leading in the senior staff room when you're sitting down with the CMO and the CNO. And, what are some of the trends that you're seeing in healthcare relative to, that rubric of leadership not being one size fits all, and a physician leader having to wear a number of different hats because they will be in the OR, they will be in the clinical environment, they will be sitting around a table with their peers. What's going on there from your perspective, trend-wise? Very generally.
Yeah. Well, we're starting to see some shifts in the medical schools, exposing folks to at least recognizing leadership and management is important as they move forward. And at the grassroots level, the students themselves say, hey, look, I need this stuff. How come I can't find it anywhere? Yeah. So there's an increased awareness of the need for this type of leadership and management exposure. But at the end of the day, however, still physicians are trained to be autonomous, independent thinkers. They are taught to learn all they can about the biology and the bad biology. They are taught to evaluate the details and to look at a variety of diagnoses and then to make decisions and give orders, right? Make decisions, give orders, make decisions, give orders. And so,
diagnose, prescribe.
Yeah, hey, sounds like command and control to me, right?
Yeah, command and control, diagnose and prescribe.
Yeah. Hey, I like this stuff. I say it, they do it. Yeah, but so there's this awareness coming out that doesn't work all of the time. And historically, actually, hospitals and delivery systems catered to the physician population. That's just kind of how healthcare evolved. In the last number of decades, that has shifted. And so the physicians and the medical staff are less angry about that shift in the relationship than they were 20, 30 years ago. So they're recognizing they've got to work better with others. And similarly, the other disciplines, clinical and non-clinical, are still recognizing, darn, we really need these physicians and we got to keep them engaged. We got to keep them organized. We got to keep them there. So how do we work better with them? So this collaborative spirit is gradually emerging, which is healthy and it's good. And so to your question, I think all disciplines, all professions are recognizing, hey, we got to collaborate better. How can we do that? And so, yes, there's an acute trauma going on and you need the command and control thing going. But then when you sit down and debrief and do quality improvement on that same case, it's collaborative. And then when you sit and go to the C-suite and say, we've had a number of cases of such and such, and the quality issues are such and such, help us change the system. That's collaboration all the way across, right?
All the way across. Yeah.
So fortunately, we're getting there. Our organization is heavily focused on that. And in fact, you've probably seen it. One of our courses are, so you're not a physician leader anymore. You got to be part of the team. So that's good. Yeah. That's healthy. And, with that collaborative spirit and better engagement across professions, we will better address a lot of those systems complexities that we talked about earlier.
Yeah. It's interesting. I gave a TED talk not too long ago, South Lake Tahoe. It's going to be up on the TED platform here next month. Okay. But the metaphor that I was working with was nature is the ultimate business guru. And I was using nature very specifically because everything overlaps. There is nothing that is not interconnected. John Muir, the naturalist at one point in time, said, if you pick up any piece of nature, you will soon realize that it's connected to every other piece of nature.
Absolutely. Yeah.
And healthcare is like that, I think, because it's a living, breathing, organistic sort of a system. And in my experience, it's been, and I'm certain that this is also part of your historical experience with it. It's because there's so much around specialties. It has become, it became siloed to a very interesting degree. And that lack of collaboration across those silos became, partly why we have some of these statistics that you cited a little bit ago. And I'm planting that comment, right here, right now, because we're going to take a brief break. When I come back, what I want to do is take a look with you about some of the emerging trends that you're seeing. And we started to talk about that a little bit, but not just in the US in healthcare, but internationally in healthcare. And I think the pandemic is becoming kind of a catalyst for some of the things that can be very generative down the road here. At least that's an assumption I'm making. And I want to check that out with you. So we're going to take a real quick break, and we'll be back. My guest today, Peter Angood, the CEO of AAPL, the American Association for Physician Leaders. I want to thank you for listening. I want to also invite you right now to go to blainebartlett.com. And on that site, which is my personal website, you'll see services up on the top menu. I'd like you to click on Leadership Mastermind. Now, why I want you to do that is we have structured a mastermind program that is very unusual and it is very powerful. And by going onto that site and clicking that link, you'll be taken to a landing page that is an invitation to join this mastermind. It's a 52-week-long exploration of what it takes to be a highly effective leader in today's fast-changing environment. You won't regret it. And if you've been liking what you've been listening to on these Soul of Business podcasts, how does one become a leader that can keep connection to the soul of business? That's what we look at. That's what we're about in this mastermind program. So again, go to blainebartlett.com and click on the services link. And there you'll find the link to the Leadership Mastermind program. Look forward to seeing you there. Thanks for listening to this little commercial. And now back to our show. Welcome back. And like I said before we took the break, I'm sitting here with Peter Angood, the CEO of the American Association for Physician Leaders. And just before our break, I was beginning to plan a little platform here for us to explore some things around in terms of trending indices in healthcare in general, but leadership in healthcare more specifically, and very granularly, just kind of the international impact of the pandemic on how healthcare is approached and delivered. And APL, although it's an American association, as you mentioned right at the beginning, it is international in its reach. So what are you seeing out there right now in terms of, is it a the end of the tunnel, or is there a train coming at us?
Yeah. I had the good fortune of interviewing Anthony Fauci a couple of weeks back, our main lead NIH person on the pandemic. And as we were having our conversation, he was making the point that we are not finished with this pandemic. In fact, the train is still coming. And we have to continue to be diligent in our public health approaches in order to better manage this pandemic. And, it's predominantly an aerosol-based infection. And so wearing of the masks is still critically important. Personal hygiene, hand washing, obviously, just a basic standard of care. And then the vaccinations, while it's a highly sensitive topic in this country, vaccination is still kind of the preferred route. And as we know, there's a bit of a debate now, should we get boosters on the existing vaccines? Not every country has got high penetration of vaccination rates. So it's not unique to the United States. And even those countries with higher penetration of the vaccine rates, they're starting to see degradation of the vaccines, increasing infections, all those types of things. So one of the, and this is not new to healthcare, it's a public health issue, it's global health issues, and that's the disparity of distribution of resources. And so the poorer countries still are sitting there with, less than 2% vaccination rate, and distribution of the vaccines within a country is horribly scattered all over the place and not organized or controlled. It's an interesting, you probably picked up on it in the last little bit as well. The World Health Organization is saying, stop debating about the vaccine boosters. We still need the primary vaccines to get out to the rest of the world, you folks.
Yeah.
Hey, so healthcare, we're seeing a lot of the same recurring issues. The pandemic and this virus is highlighting them up for everybody to see, and actually to everybody to feel it themselves, because it's getting us all, right? Whether you choose to wear your mask and get vaccinated, or whether you choose to not wear your mask and not get vaccinated, we're all seeing both sides of that equation all the time. And we're able to put it in the context of this is a global thing. So internationally for us, we've always got members in 40 or so different countries at any one time, and what we're hearing from different folks is it's the supply chain, it's the dissemination, it's the access, and it's getting the proper care for people to really get better outcomes overall. So it's highlighting the inequities of public health. It's highlighting up the common term that you hear all the time, the social determinants of health. That's kind of things like access and proper nutrition and all those sorts of things. So as we look at our numbers, those who have poor elements in the social determinants of health, they're having worse outcomes with the pandemic and the inability to get access, or they choose not to because they're suspicious of our healthcare system, right? They're suspicious. And so how do you overcome those kinds of things as well?
Yeah. Again, I go back to my definition of leadership: co-creating coordinated movement. How do physicians, in particular, because this is who your constituency is primarily, how do physicians actually get in front of that distrust?
Right.
Yeah. I mean whether it's the family practitioner that's sitting with somebody, or a physician leader, a chief medical officer in a large system. How do you get in front of that trust as a leader to co-create coordinated movement rather than division?
Yeah, that's a great question, and your catchphrase is really important, and I'll drive it back to the beginning of our conversation, and that is to leverage that altruism and to further leverage that patient-physician relationship, because it's not just the healthcare system that expects that patient-physician relationship to be the driver, but patients by and large, regardless of the socioeconomic setting, will want to rely on their physicians to give them their advice or to help them with their decision making. You know, I always come back, a very brief anecdote here, not an anecdote, just a sideline. You know, I did this trauma surgery thing for many, many years, and therefore I operated on a lot of badass criminals.
Mm-hmm.
When they were almost dying, they were pretty nice people. They were pretty nice people, Blaine, because they realized they didn't want to yet die. And so how do we leverage that trust that the general public and most people place on physicians in recognizing, I want some more information, and even if I don't want it, but they start talking to me, I'll listen to them. And so the physicians need to get back to that. And you've heard me say this before, all physicians are leaders at some level. So how do we get those physicians to assume that responsibility of leadership, to then get that message and leverage their altruism themselves and leverage that relationship to create the change? And you know, there's a couple of stories out there of family physicians going door to door in their neighborhood, in their catchment area, and saying, "Get the darn vaccine, folks."
Yeah,
they've got it figured out.
Leverage the. I was talking to somebody the other day, and part of my bias is that all any organization is a collection of people that are in relationship. That's any organization. And the obvious is the interpersonal. That's the tip of the iceberg. But relationship with values, relationship with the vision of the organization, the relationship with fill in the blank. Anything that the organization actually presents, there's a relationship quality to it. And the assumption on that phrasing is that I need to work to develop a healthy relationship. And what's interesting in this conversation I had with this fella, he kind of pushed back on me a little bit on that. And I really appreciate it, because he said, you're not going to get a healthy relationship unless you've got a solid foundation of trust. So you need to have the focus on the building the trust first before you can ever hope to have a kumbaya relationship. And if you're looking at a kumbaya relationship, you probably haven't paid attention to the trust aspect. You're just looking to be liked. So that doesn't work. And so this morning in my shower, when I was thinking, and this is me on my soapbox here, but I was thinking just about and I don't want to get into a whole political sidebar on this, but if anybody that's in a position of power, whether it's a politician, whether it's a medical practitioner, whatever, if they weren't concerned with their job, if they weren't concerned about staying in position, what would they do with this pandemic? What would they be presenting, and how would they go about doing it? And trust seems to be, to me, the foundation on which they would have to stand if they weren't concerned about their position. They were just doing what they thought was right. Now that's my. There's not a question embedded in that. That's me using the platform. But and where I would take this, just in terms of actually framing the question, burnout is part of the equation in healthcare right now, particularly amongst the physician and the nurses. Just anybody associated with this. And as far as I can tell, burnout, most people would attribute it to working too hard, long hours, all that kind of stuff. And you and I both have had experience where I've just worked, incredibly long hours and walked away feeling really invigorated.
Yeah.
And what made that possible was I was connected to a valued for the sake of what? Value, that altruistic piece. I'm seeing a lot of burnout in the systems in which I'm working right now. And the folks that I talk to, they feel disconnected to their ability to be, in front of that altruistic dynamic, or even connected to that altruistic idea anymore, because there is so much noise in the system. And this would be my last question for you around this. As a trend, what are you seeing physicians paying attention to? What are you seeing administrators and leaders paying attention to that enables people in the systems to stay connected to that altruistic piece that actually gives healthcare its soul?
Yeah, I wish I had a really sweet answer for you and we could really
Yeah,
feel good about it,
I
but
wish
that's,
you did too.
oh man, unfortunately, healthcare is just a wonderful, wonderful profession to be in because it is deeply personal and you're helping people and you see results and people are appreciative and they trust you. And every nurse, every physician, every pharmacist has got stories of how some patient made them feel better because they helped them. I haven't been clinical for almost 15 years, but I've still got warm thoughts of people from my early years and all that kind of
Yeah,
stuff. And the workforce is not getting enough of that anymore. And
yeah,
that's their altruism, their idealism, their caring, kind people. And as we were saying earlier, it's that complexity of the systems and processes that have leaked in to this industry that to some degree prevent them from doing that. And to answer your question, we talk a lot about patient-centered care, and some folks are now calling it person-centered care. And actually, I take the opposite direction. I think person-centered care is the most disruptive force in healthcare right now because we don't know how to do it.
yeah,
We talk about it,
absolutely.
but
Yeah,
we don't know how to do it. So it's
know how to do.
disrupting us. And so the trend really is to how do we get to truly fix the systems and really gradually do that so that we can maintain the bit of wellness that we have in the workforce, but how do we re-attain that pride, that professionalism, that sense of awe and wonder about being a healthcare provider?
Yeah,
And whether you're a non-clinical administrator or a clinical leader, you want to help others in your workforce regain that sense of pride, that sense of professionalism, and that sense of beauty of helping others. You know,
yeah.
that's what we
Beauty.
need to get. We can
I,
talk telehealth, we can talk value-based care, we can talk all sorts of other catchwords, but I think I was hitting more what's more important than that stuff.
yeah, I love that word beauty. Buckminster Fuller years ago said that when I'm designing a solution to a problem, beauty doesn't come to mind for me while I'm in the midst of doing it. But at the end of the day, if my solution isn't beautiful, it's likely not the right solution.
Right. Yeah.
And
Yeah.
and beauty being an expression of that inner spirit. Yeah, when that inner
Absolutely.
spirit is tapped into, it's a beautiful sunset. It's just magnificent. So,
Yeah.
Peter, I'm going to close off here with a question for you, just because I've gotten to know you, and I know that you've actually you answer this question just through your beingness. But how are you leaving it better than you found it?
You know, um, it's interesting. Careers are fascinating. I never for a moment ever thought I'd be an association leader. And, I was privileged to inherit this organization about a decade ago. We've transformed it in a whole variety of ways. And I think what we are trying to capitalize on, and successfully, although it's a gradual process, is to better elevate the role of physician leadership and to help individuals as physicians appreciate physician leadership is better, to help other professions in the industry better appreciate the importance and the critical nature of physician leadership, and that will gradually continue to expand how organizations better integrate physician leadership into their practices. And then finally, we're gradually expanding our activities internationally, and there's only about a dozen countries out there that do anything near to what we do, Blaine. And of those, they all look to us as the leaders of physician leadership. And so, how do we continue to leverage that? So it's just been a wonderful decade, and I think we've made some big changes, and we just keep living to that moniker. All physicians are leaders at some level. And ultimately, what we're up to do is trying to create significant large scale change in healthcare by leveraging the platform of physician leadership. So thank you.
There you go. Absolutely. Thank you. My guest today, Peter Angood, CEO, American Association for Physician Leadership. Peter, love talking with you. I've never had a bad conversation with you, whether it's over a glass of wine or whether it's via Zoom. I just appreciate
Likewise,
you
Glenn.
immensely.
Yeah, it's always a pleasure. I always learn lots, and I always appreciate the depth of thought and intellectual challenge that you put into your thinking. So thank you for today.
Thank you for saying so. You've been listening to The Soul of Business with Blaine Bartlett. Go to my website, blainebartlett.com. There's a number of resources there that you can check out in terms of developing your own leadership expertise and whatnot. And until we have our next time together, I want to just thank you for listening and have a great rest of your week. Take care.